Everybody in the world has been concerned about coronavirus, and rightly so. One of those people that's concerned about it is Dr. de Villa. She is the Chief Medical Officer of Health in the City of Toronto. She joins me right now because I want to ask you, after you've been into it, as you're just saying, probably 6 months, most people into it for 4 months, day by day by day, looking back on it, are there things you would have liked to have done differently, Doctor?
Well, I think that as a public health professional, if you're not looking back at your work and thinking, how could I have done this better? What might I have done differently or done better? Then you're not really doing your job as a professional.
So the answer is yes. Can
you
divulge it to us?
Things, of course. So I think if I were to say that there was something we could have improved, I think we actually did a really great job. And I think that Toronto Public Health has done a fabulous job as a team.
Any changes,
if there was
though?
something I would have changed, more, faster.
Okay, so here we are. We are at the Courtyard in Toronto. It's opening up. There'll be people here tonight. Are you happy with the way it's opening up, and do you anticipate a spike?
So I think when we're talking about the way we've opened up, we've tried to do that with great caution and very conscious of what the data are, what the science says. So for example, being in this outdoor space, we know that the risk of transmission, while not zero, is significantly reduced when you're in an outdoor open air environment.
Right.
So I think this is exactly the kind of thing that we can do in a safe way. It's a way for us to coexist as safely as possible with COVID-19 in our community.
Let's talk on behalf of all the parents of school kids who have not been in school for months and months. Do you think that schools should be brought back this September?
So I do think that we have to find ways to coexist safely with the virus and recognize that we have to both manage COVID-19 and the risks that are directly attributable to it, and also continue with some form of life, recognizing that suspending all those activities, like school, also has significant health impacts. So I do think that we should find a way to do that, and I know that we're working with our school boards to figure out what is the safest way, and will we have different methods by which we can continue the benefits of education while at the same time managing risks of COVID-19? You're
the medical officer of health. You not only deal with physical health, but mental health. And
yes.
I'm told by all sources that the incidence of mental health, is on the rise. Is that going to be something the City of Toronto's got to focus on in the near future?
Absolutely. Actually, I was just speaking about this the other day. We're doing deeper dives into our data to understand how COVID-19 has impacted our city.
Whether the lockdown.
Yeah, absolutely.
So has the city got to come up with more money, more facilities to help these people who are negatively impacted?
Well, I would suggest that that's not exclusively in the city's purview, right? That is something that all three levels of government must come together and work on, because really at the end of the day, health is all of our business. And it's not, health is actually the result of a number of different aspects. It's not just health care, and it's not just public health. It's all about the social determinants of health, the conditions in which we live, and all three levels of government have a role to play in that.
Were you just throwing a shot across the bow of Premier Ford and Prime Minister Justin Trudeau? Are you going to be going to them for money?
I would not call that a shot across the bow. I'd call that extending a hand.
I love it. What a wonderful way to end it. Thank you very, very much, Dr. de Villa.
Thank you.
That's 3 minutes. Thank you for watching. We are going to continue to broadcast from the secret bar here on top of the George Restaurant Courtyards on Queen Street East in Toronto. In these days, where politicians are spending a lot of your money, Parliament's not sitting, it's important to have an independent news source. That's what we are doing. We hope you subscribe.